Congratulations! Thank you for purchasing a Clench Relief mouthpiece. I'm Dr. David Frey, inventor, dentist, and Chief Dental Officer of Clench Relief. Now that you purchased a Clench Relief mouthpiece, I'm going to show you how to fabricate it in less than 10 minutes. The first thing you're going to do is lay out all your items. We have a Clench Relief mouthpiece frame. We have the Clench Relief anterior alignment guide with the number 2 on it. We have the dental putty, silicone, PVS material, catalyst and base. We have a scalpel or sharp knife to do some trimming. And we also have a pencil to mark some alignment on the patient's face to make sure they're centered. We also have a timer to make sure that we work at a constant rate to make sure that the putty sets in time that's in the patient's mouth at the proper time allotment. To begin with, we're going to take the Clench Relief mouthpiece and we're going to align the Clench Relief alignment guide onto the frame. Make sure that the words Clench Relief are upright and the number 2 is upright. I'm going to snap that into the frame as such. You hear a little snap as it goes in. I'm going to center the line in the alignment guide right in between the word clench and relief, just like this. The patient is going to bite gently or rest their incisal edges into the alignment guide's grooves. I'm going to now place it in the patient's mouth to just test it. And go ahead and bite down. Perfect, smile. And I make sure that the line is centered with the chin and the center of the face. Once we know how to do it, I'm ready to mix my PVS material together. So I'm going to make sure my timer is set. I'm going to begin now. Take the 2 pieces of putty and start mixing. Make sure that all the white putty is completely integrated into the yellow putty. I'm using my fingers to knead the PVS material into one solid color. I'm going to continue mixing until it is all one color. I still see some white, so I'm still going to keep kneading and mixing until all the white material is fully integrated. Once I have one solid color, I will then roll it up into a hot dog, like this. Once I have my hot dog, I am going to break it into halves, into 2 pieces. And I'm going to pack from underneath the mouthguard frame. I'm going to really pack it in and take any excess away, just like that. And I will pack the other side, just like this. Once it's all in, I'm then going to place it in the patient's mouth and have her close. Perfect. Gently close and relax. Do not bite hard onto the alignment guide. Just feel relaxation, smile, and relax all your muscles. You can also swallow a few times as it's setting and stay in perfect posture. It's now been over 3 minutes since we began timing. I could see my little ball that I kept back is getting hard. I'm going to gently remove it from the patient's mouth. I'm going to lift up from the bottom and remove it. I can gently feel that it's nice and hard already. It's not fully cured, but it's curing very nicely. The first thing I'm going to do is remove the alignment guide from the frame. I will then let the Clench Relief mouthpiece cure for a few more minutes to get very hard. After a minute or 2, I may take a sharp blade and just scallop away some of the excess PVS away from the frame. Be careful not to cut the frame, but just go along the borders of the frame and remove any excess. I am going to try it on for fit to see how it fits in her mouth. Go ahead and close. You can see that when she closes, the center of her front teeth are lined up with the center of her bottom teeth. You can also see that the frenums inside her mouth are lined up even. So her upper frenum and her lower frenum are lined up. This is also very important. She now has a completed Clench Relief mouthpiece with no lab that has repositioned her lower jaw into a zone of comfort with her muscles and her jaw joint. Try opening and closing very wide and close. Open as wide as you can and close and open and close. You can feel that her jaw, TMJ, is on alignment with her bite. The Clench Relief mouthpiece was just fabricated in under 5 minutes. It's a custom fit, as if it went to a lab without going to a lab and without paying the high lab bills that we're all used to paying. Go ahead and put it right into the mouthpiece case and hand it to the patient. She can even wear it on the way out. She can sleep with it, and it's ready to go.